It's gonna be
Oh, pretty confident, dude. You don't insert a knife directly. First, you use your finger, palpate, and see where is that thyroid knot. Back with more neck slicing madness. Pens, straws, high stick dramas. Let's all react to it. Breathe through it. Again. Hey friends, Dr. Bob here, and reacting to emergency tracheostomy scenes from movies and TV shows part 2. So let's get into it. Yep, he's not breathing. First thing you check in the mouth and there's something coming up.
Damn, what's that? Wasp. Deadly.
His airways again compromised because of that.
I got whiskey in my flask.
And this guy seems like he's pretty confident to what he's doing. Okay, he didn't even palpate where he's gonna make the incision. He just directly went knife first. Wouldn't recommend that. Oh, pretty confident, dude. You don't insert a knife directly. First, you use your finger, palpate, and see where is that thyroid notch, where is the cricoid, where is the membrane, cricothyroid membrane. Then you make an incision, open. Once you open, then again, straw. Really fictional, but I don't think it's possible in real life scenario. So just to clarify, what is tracheostomy and cricothyroidotomy? As the word says, tracheostomy is in the trachea. We make an opening in the trachea and the tube goes in. Whereas cricothyroidotomy is happening in the cricothyroid membrane, which is pretty much of an emergency scenario where you don't have much time. It is not like an ICU setup, or it's not like an OT setup or hospital setup where you have the time and all the medical requirements to peacefully do. Whereas if you have a situation where it is an emergency, you have to open up. That's where you cricothyroidotomy.
I think she broke her neck.
Okay, you just keep hold. Very
Okay.
tight. Please help my daughter. No, her neck's not stable enough.
I like how much importance they're giving to
Yeah, I know,
broken
but we
neck.
need to get her midline.
Always one of the main things where we make sure the neck is in the center. We keep the collar to prevent it from further damage or injury to the rest of the body. Because that's where the spinal cord is. If that's injured, pretty much the patient go into paraplegia or weakness of the whole body. So far, so good.
Okay, I'm gonna gently get her on a mask and pre-oxygenate. I'm gonna prep her meds.
BP's 80/50, respirations at 8.
Copy that.
Okay, so she's mentally
I need
prepared
to
to do
keep neck
something.
stabilization.
I got
Thank you.
Okay, she's intubated.
Preparation,
So
pre-oxygenation,
she's going nasal
pre-medication,
intubation, and that's
paralyzed,
reached
past the tube. Proof. Thank you.
saturation maintained.
Okay, it's a load and go, guys. Bring in the board.
That's good. So they didn't have to do a tracheostomy. Because of the intubation that helped, they secured the airway. So we don't need to have to make a tracheostomy or a bypass where we already secured. She did miss out to put lignocaine jelly, which is supposed to be put generously, especially when you're doing nasal intubation. You don't want to go directly in with the tube because of which you can traumatize the nose, nasal mucosa, which can be traumatized if we don't use lignocaine jelly. So that they missed. So tracheostomy as something was started around 3600 BC in ancient Egypt, and first documented tracheostomy was done in 1546 by Antonio Brassavola, an Italian physician who did it for a patient with neck abscess. So fast forward to today, it's done routinely, actively for every patient that's been there having prolonged intubation history or an emergency situation in trauma care, ICUs, hospital setup, everywhere. Hey, if you're watching the video till now, don't forget to hit that like button and subscribe for more. And hey, if you want part 3 of this series, you know what to do. Okay, emergency cricothyroidotomy. Okay, so as you can see, he's directly starting off making incision. Yep, vertical incision, as I always told you. For an emergency procedure, we do the vertical incision. He's making an opening into the membrane, cricothyroid membrane. He's opened it. Once he's made the opening, then next the tube goes in. Yep, tube is going in place. A really good work of hands. I can see how confidently and how properly. And yes, he's inflating the balloon, which is there part of the tube. And yeah, Stilet is out and the airway is secure. He's just tying the knots, keeping the tube in place. And yeah, it's a good job and really fast and quick tracheothyroidotomy that he's done. As you can see, it is an emergency, very much of an emergency, where you have a couple of minutes before the patient can go into hypoxic brain injury. And that's one of the best way you can recover a patient who's gone bad because of a blocked airway. So, good job. Really liked it. Okay, so here also vertical incision. Okay. They're using a dilator, tracheal dilator. But I don't see the requirement in this scene where he did a vertical incision. It's just a hospital setup. He can do a peaceful horizontal incision. As you can see, post-surgery, the surgical scar is much lesser if it is a horizontal incision than a vertical incision. That's why it's most preferred if you're doing in an elective setup. And next, what I see is that he's using a fenestrated tracheostomy tube. It is always better to use a cuff tracheostomy tube because of the cuff, which is there, the balloon which is there. It prevents air leak, where that is pretty much not happening with this. Okay. Tube goes in, secure, connecting the back. Yep, it's good. So basically, again, patient, the tube is in and the ampu bag is connected to it, and direct ventilation goes to lungs. The adequate chest rise is seen, and you have succeeded. Did you know that tracheostomies are even done for babies who's having congenital disorders such like laryngomalacia, tracheomalacia, subglottic stenosis, vocal cord palsies? So as you can see, movie tracheostomies can be dramatic or chaotic or even extremely genius. But don't let that fool you. Real life airways are delicate, high risk, and require high precision. So always trust trained hands over cinematic flight. So that's all for today, my friends. I hope you guys liked it. And hey, if you guys haven't watched the part 1 of this series, I'll mention it in this video. So do check it out. And do follow for more medical breakdowns. So until next time, you guys, take care, stay safe. This is Dr. Bob, signing on.